Meet Mr. F. You may remember him as he was featured in last week's case study on the dietary management of atherosclerosis. Because Mr. F will also be featured in this case study on the surgical management of atherosclerosis, we will give you a quick recap as to who Mr. F is. He is a 54-year-old male who is 6 feet tall and weighs 235 pounds. He is a business owner and a pharmacist who is currently struggling with health complications. He has a presence of atherosclerosis that he has been treating with diet and exercise. It has now been 1 year since Mr. F's angioplasty that was discussed in the previous case study. Over the past year, he has been taking his nutritional supplements and following the diet prescribed. He started exercising at a slow rate, but has now increased to 45 minutes of fast-paced walking a day. In total, he has lost 20 pounds and is feeling much better. It seemed as though everything was falling into place for Mr. F. Most recently, Mr. F has been struggling with environmental factors that have inhibited his compliance with diet and exercise. He's gotten very busy at work and has been struggling to complete his exercise routine now that winter is setting in. Christmas holidays have also caused him to forgo his diet. Additionally, Mr. F has stopped taking his nutritional supplements as he is finding their high cost way too hard to maintain. All these factors have led Mr. F to slowly regain the weight he had lost over the past year. With the past year's events in mind, there are 3 main points we would like to update you on Mr. F. His dietary supplementation did not last, his angioplasty was not effective, and now surgery is required to manage his atherosclerosis. Due to diet and exercise non-compliance, the next step for Mr. F was pharmaceutical management. Diet and exercise clearly weren't working, therefore Mr. F's doctor prescribed medication to help lower his overall cholesterol, his triglycerides, LDL cholesterol, and raise his HDL cholesterol. He was prescribed Lipitor at a dose of 10 milligrams per day, which resulted in positive improvements to his overall blood lipid profile after 6 weeks. Because results were improving, Mr. F began to eat whatever he wanted, reduce exercise, and test his own cholesterol at home. Fast forward to the summer when he experienced another cardiac event while mowing his grass. He had chest pains, profuse sweating, but refused to go see a doctor. Another cardiac cath procedure was conducted in which revealed 3 major blockages. Mr. F had no choice but to undergo a triple coronary artery bypass graft. Now let's assess Mr. F's case a little further.